could you describe for our audience, like, what are some of just the general principles, general approaches to healthy sleep, generally speaking?
Yeah, so there's a lot of things in sleep science and phrases that we say to try to remind people how to sleep well. I'll just throw a couple of them at you right now. So they say sleep in a quiet, dark, cool environment. Big takeaway. Even, changing your environment in subtle ways to make it less activating. Like, you should think about the layout of your bedroom and how to make it so it's as calming of an environment as possible. I like those solutions because it's not something you have to constantly remember to do. It's something you do once and then your sleep is improved. So I think about my lighting a lot when I'm thinking about my environment. And like me and my fiance, for example, have this nice bedtime ritual where we have a very dimly lit bedroom environment. We read a book a little bit in bed, which is actually, if we had a sleep problem, I wouldn't recommend that. And then we fall right asleep. So that's another big one, is having a sleep ritual. Another thing that they say in sleep science is save your bed for sleep and sex only. So trying to build the bed as this sanctuary for all you're doing in there is sleeping, and we'll let you have sex a little bit too, which is actually can help you have a deeper night of sleep.
That's great.
Those are just a couple of the things in sleep science. There's also weird words in sleep science that I love, like chronobiology, zeitgeber, suprachiasmatic nucleus. A lot of these scientific terms are sort of ways of giving us a metacognition of our sleep. And I think that's one of the big ways that you can improve any health outcome. And in psychology, they've shown time and again that, for example, if you're aware of some kind of issue you have with depression, for example, that meta-awareness that you are in a depressed state significantly helps deal with that depressed state. So if you're schizophrenic, for example, a lot of times you're not aware, you don't have metacognition of that, and that's why schizophrenia can have such bad outcomes sometimes. So building this metacognitive awareness of where I'm at in my circadian rhythm right now. I know how much sleep I need and if I got it last night or not. And then being able to adjust based on that metacognition.